Can a pulse oximeter detect sleep apnea? Have you ever wondered if a simple device like a pulse oximeter can help identify sleep apnea? This question is more common than you might think. Sleep apnea is a condition where breathing repeatedly stops and starts during sleep, leading to drops in blood oxygen levels. A pulse oximeter measures the oxygen saturation in your blood and your pulse rate. So, can it help with sleep apnea detection? While a pulse oximeter cannot definitively diagnose sleep apnea, it can provide useful information. It continuously monitors oxygen levels during sleep, which can indicate potential issues. When someone has sleep apnea, they often experience drops in oxygen levels, known as oxygen desaturation events. A pulse oximeter can detect these events, showing when oxygen saturation falls below normal levels. By analyzing the patterns of oxygen levels, healthcare providers can get clues about possible sleep apnea. For example, the oxyhemoglobin desaturation index counts how many times oxygen levels drop per hour. This information can help categorize the severity of sleep apnea into mild, moderate, or severe cases. However, it is important to note that the accuracy of a pulse oximeter for detecting sleep apnea is moderate. Sensitivity and specificity rates usually range from 60% to 80%. This means that while it can be helpful, it is not foolproof. Other factors, such as poor blood flow, movement, skin color, or even nail polish, can affect the readings. From a survival skills perspective, having a pulse oximeter in your first aid kit is a smart choice. It is non-invasive, portable, and easy to use. In situations where professional medical help is not available, it can provide early warning signs of oxygen desaturation during sleep. This can prompt timely medical consultation or evacuation if necessary. However, remember that a pulse oximeter cannot detect actual breathing pauses or differentiate between types of sleep apnea. It should not replace a comprehensive medical evaluation. If you suspect someone has sleep apnea, it is essential to seek further testing, such as polysomnography, which is a detailed sleep study. In summary, while a pulse oximeter cannot diagnose sleep apnea on its own, it can be a useful tool for monitoring oxygen levels. It can help identify signs that suggest the presence of sleep apnea, guiding decisions for further testing or emergency care. So, if you are putting together a first aid kit for survival situations, consider including a pulse oximeter to monitor oxygen levels effectively.